There is a moment that takes place silently inside the body after the age of 60, and most people never even notice it. The same medication you have relied on for years, the one your system handled without any trouble, can suddenly start working in a completely different way. Not because the medication itself has changed, but because your body has. And in some cases, that difference is not minor. It can be the line between protection and danger, between staying stable and slowly drifting towards something far more serious, like a heart attack or a stroke. What makes this particularly alarming is that nothing feels off at first. No visible warning, no discomfort, no obvious sign, just a quiet internal shift. And today we are going to walk through 5 specific categories of medications that, past the age of 60, have been connected to a higher risk of cardiovascular complications, especially when certain health conditions are present or when they are being used exactly the same way they were years ago. But here is the part that matters most. This is not about creating fear. This is about building understanding of what is truly going on inside your body so you can move forward with better and more informed choices. My name is Dr. Eric Cenat. I am a medical doctor and physician, and on this channel I take complex health subjects and break them down into clear and practical explanations so you can gain a better understanding of what may be happening inside your own body and what genuinely makes a difference over time. If this type of content is useful to you, feel free to subscribe, but more importantly, stay with me through this entire video because one of the medications we will cover today is used every single day by millions of people and almost never reconsidered. Now, to truly understand why these risks grow after 60, you have to start with something that most people were never told. Your body no longer handles medications the way it once did, and that is where everything begins to shift. As we get older, several key systems in the body begin to slow down. The liver, which is responsible for metabolizing many medications, becomes less efficient. The kidneys, which remove waste and excess substances from the blood, also begin to lose some of their filtering capacity. What this means is that drugs remain in your system longer, sometimes far longer than anyone intended. And when that happens, even a standard dose can begin to behave like an excess dose over time. But that is only one piece of the picture. There is also a change in how your blood vessels respond. Your arteries become less elastic, the inner walls of your blood vessels grow more sensitive to pressure and stress, circulation patterns shift, and the delicate balance between clotting and bleeding becomes more fragile. So when a medication acts on any of these systems, the result can be amplified. And this is where people are often misled, because the medication itself is not necessarily the problem. It may have been completely appropriate when it was originally prescribed and may still serve a purpose today, but the circumstances have changed. And medicine, more than most people understand, is entirely dependent on circumstances. The same drug can support health in one situation and create risk in another. The same dosage can be right at 50 and excessive at 70. And yet, in everyday reality, prescriptions are frequently maintained for years without being carefully reassessed, not because physicians are negligent, but because these shifts happen gradually and quietly in the background. Now, here is where it becomes more serious. After 60, the baseline risk of cardiovascular events such as heart attack and stroke already rises naturally. That is a known and documented reality. But when certain medications are added on top of that, especially without any adjustment, they can push that risk even further, sometimes subtly, sometimes significantly, and often with no noticeable symptoms until something serious occurs. That is exactly why what we are discussing today is so important, because we are not just talking about pills. We are talking about how your body interacts with them right now, at this specific stage of life, and more importantly, what you can actually do about it. Now, before we get into the first 2 medications, there is one essential point you need to hold on to. Nothing we are about to discuss is a reason to stop any medication on your own. That is not what this is about. The purpose here is awareness, because when you genuinely understand how something functions, you are able to ask sharper questions, have more productive conversations with your doctor, and avoid staying on autopilot with something that may no longer be right for you. And this is where the first level of risk begins, because the first 2 medications we are going to examine are among the most frequently used, especially after 60. They are often taken on a daily basis, they are widely regarded as safe, and yet under certain conditions, they can quietly place added strain on the heart, shift blood pressure in the wrong direction, or interfere with how blood moves through vessels that are already more sensitive than they used to be. And once you see the mechanism behind that, you will begin to understand why this is not simply about the pill itself. It is about timing, it is about dosage, it is about how your body has evolved. And that is precisely where we are headed next. Let us begin with something extremely familiar, a type of medication that a large number of people take without hesitation, often for years, sometimes for decades, and yet after 60 it starts to behave very differently inside the body. The first category is a group of drugs known as non-steroidal anti-inflammatory drugs, or NSAIDs. This includes medications such as ibuprofen, naproxen, and certain prescription-grade anti-inflammatory drugs. They are widely relied on for joint discomfort, back pain, arthritis, and general inflammation, and for many people they feel like an easy fix. You take one, the pain fades, and you carry on with your day. But inside the body, something else is taking place. NSAIDs function by blocking specific enzymes involved in the inflammatory process. That is what eases the pain. But those same enzymes also play a role in protecting your blood vessels and keeping blood flow regulated. And this is where the problem begins. After 60, your blood vessels are already less flexible. The inner walls of your arteries have become more reactive to stress and pressure. When NSAIDs interfere with that protective mechanism, it can lead to a subtle narrowing of blood vessels. That narrowing pushes blood pressure upward, and not always in a way that is immediately obvious. It can be slow, quiet, but ongoing. At the same time, NSAIDs can interfere with how the kidneys manage fluid in the body. They can cause the system to hold on to more sodium and water, and that places extra demand on the heart. Now, two things are happening simultaneously: rising blood pressure and increased fluid load. And for someone whose cardiovascular system is already under greater demand after 60, that combination carries real weight. Multiple large-scale studies have shown that prolonged or frequent use of NSAIDs is associated with a higher risk of heart attack and stroke, particularly in older adults or those who already have cardiovascular risk factors. And this is where people are misled because the relief is felt right away, but the impact accumulates quietly. You cannot feel your blood pressure climbing in real time. You cannot sense the additional strain on your arteries day after day, but over time it builds. Now, the critical point here is not that NSAIDs are harmful. It is that they need to be used with full awareness. Short-term use, occasional use, carefully monitored use may still be entirely appropriate. But daily long-term use without any review after 60, that is where the risk begins to grow. And that brings us to the second medication, because this one is even less obvious and even more overlooked. It is a category of drugs called proton pump inhibitors, commonly referred to as PPIs. These include medications such as omeprazole, esomeprazole, and similar acid-suppressing drugs. They are frequently prescribed for acid reflux, heartburn, and stomach protection, particularly in people who take other medications that can be harsh on the stomach lining. And at first glance, they appear completely harmless. They lower acid, they ease discomfort, they shield the stomach lining. But this is where things become far less straightforward. Stomach acid does not exist simply to cause problems. It plays a key role in absorbing essential nutrients, particularly magnesium, calcium, and vitamin B12. And over time, prolonged use of PPIs can reduce how well the body absorbs these nutrients. Now, that may not seem directly connected to heart attack or stroke risk, but it absolutely is. Magnesium is critical for maintaining a stable heart rhythm. When magnesium levels fall, the risk of irregular heart rhythms increases. Calcium balance is essential for vascular function, and vitamin B12 supports the health of blood vessels and the nervous system. When these levels are compromised over time, the cardiovascular system becomes more exposed to risk. But there is another dimension to this. Some research suggests that long-term PPI use may impair the function of the endothelium, the inner lining of blood vessels, and that lining is fundamental to regulating blood flow, clotting, and the ability of vessels to relax properly. When it does not work as it should, the risk of vascular complications rises. And again, this does not happen overnight. It develops gradually, without making any noise, and often without any clear symptoms. Now, here is the mistake most people make. Many individuals begin taking a PPI for a short-term issue like acid discomfort or stomach irritation, but then continue using it for years without any reassessment because it feels benign, because it was prescribed, because nothing seems to be going wrong. But the longer it continues without being reviewed, the more those underlying effects begin to matter. And this is where awareness changes everything, because in many cases the answer is not stopping the medication entirely. It may simply mean adjusting how long it is used, reconsidering whether it is still needed, or exploring whether a lower dose or different approach makes more sense. But that only happens when someone asks the right question. Now, what we have covered so far is just the first layer. Two very common medications, two mechanisms that quietly increase cardiovascular strain over time. But what comes next goes deeper, because the next two medications do not just affect pressure or nutrient absorption. They interact directly with how your heart operates, how your blood circulates, and how your body responds under physical stress. And once you understand that part, the full picture becomes much clearer. Now, this is where things begin to shift from subtle to something considerably more significant, because the next two medications do not simply influence blood pressure or nutritional levels. They interact directly with how your cardiovascular system behaves under strain, and in many cases the effects are not felt immediately. They develop slowly across months, sometimes years, which is exactly why they so frequently go undetected. Let us look at the third one. A category of medications widely used for sleep difficulties, anxiety, or settling the nervous system. These are known as benzodiazepines. Examples include diazepam, lorazepam, and similar drugs in that family. They are effective, they can reduce anxiety quickly, they can support sleep, and for many individuals, especially as they get older, they feel like something essential. But here is what is happening beneath the surface. Benzodiazepines act on the central nervous system. They reduce brain activity, which produces that calming effect, but they also slow down other systems in the body, including breathing, reaction speed, and physical coordination. Now, you might ask yourself how that connects to heart attack or stroke risk. This is where the mechanism becomes important to understand. As the body ages, it grows more sensitive to these medications. They linger in the system longer, they accumulate more easily, and their sedating effect becomes more pronounced even with the same dose over time. This can result in less physical movement, more time spent sedentary or resting, and that matters far more than most people recognize, because proper circulation depends on regular movement. When movement decreases, blood flow becomes less efficient, the likelihood of clot formation increases, and the delivery of oxygen to tissues becomes less effective. But there is yet another dimension to this. Benzodiazepines can influence breathing patterns during sleep. They can contribute to shallow breathing or worsen already existing sleep-related breathing issues, such as sleep apnea. And when oxygen levels dip repeatedly during the night, even in small amounts, it creates added strain on the heart. Now consider what is building simultaneously: reduced circulation, lower oxygen levels, and a cardiovascular system that is already more vulnerable with age. And again, none of this feels dramatic. It shows up as fatigue, it shows up as slower mornings, it feels like ordinary aging. But underneath, the body is carrying more stress than it should be. And this is where the long-term consequences begin to matter, because over time these small, compounding changes can contribute to a meaningfully higher risk of cardiovascular events, especially when combined with other factors like elevated blood pressure or existing vascular conditions. Now, here is something that often goes unrecognized. The risk does not come purely from taking the medication. It comes from taking it continuously without ever reassessing as the body continues to change. And that leads us to the fourth medication, because this is where things become even more layered, not because of what the drug does on its own, but because of what happens when it enters a combination. The fourth category involves certain decongestants and stimulant-type medications. This includes drugs that contain pseudoephedrine, as well as various combination cold and flu products. These are typically used for nasal congestion, colds, or seasonal allergies, and they are easy to get hold of. Many are sold without a prescription, which naturally makes them feel safe. But their mechanism works in a very different way. Decongestants work by narrowing blood vessels. That is how they reduce swelling in the nasal passages. But that effect does not stay localized to the nose. It extends to blood vessels throughout the entire body, including those that feed directly into the heart. When blood vessels narrow like this, blood pressure rises, the heart rate can climb, and the heart has to work considerably harder to push blood through a more restricted system. Now, in a younger body with more elastic arteries, this effect is usually managed without issue. But after 60, when arteries have already lost much of their flexibility, that added constriction can become genuinely significant, especially if someone already deals with elevated blood pressure or is taking medications that also affect cardiovascular function. And this is where combinations become particularly problematic, because most people are not taking just one medication. They are managing several: a blood pressure medication, a pain reliever, something for sleep, and then during cold season or allergy flare-ups, a decongestant gets added on top of everything. Each one individually may seem manageable, but together they begin to interact in layered ways. One raises blood pressure, another affects fluid retention, another slows the system down, and the body has to work harder to compensate. Now here is where people are often caught off guard, because the triggering event, the moment something goes wrong, can feel sudden. But the accumulation behind it has been building for a long time. This is what makes these situations so deceptive. It feels like it appeared from nowhere, but in reality it was a slow and quiet buildup of pressure on the cardiovascular system. And this is precisely why awareness is the most powerful tool, because when you understand how these medications interact, you begin to recognize patterns and see when something may have stopped working in your favor. And that is where the final piece becomes critical, because there is one more medication to discuss, and this one stands apart not because it is uncommon, but because it is one of the most widely used substances in the world. Used every day by millions, trusted by nearly everyone, and almost never questioned. And once you understand how it affects the aging body, it completely changes how you look at it. This is the one that tends to catch people off guard the most, not because it is unusual, not because it is rarely used, but because it is everywhere. Taken daily, assumed to be completely safe, and in some cases treated almost like a health ritual. And yet, after 60, the way it interacts with the body can quietly shift toward a direction that raises cardiovascular risk, particularly when it is used without any ongoing evaluation. The fifth medication is low-dose aspirin. For many years, aspirin was broadly promoted as a simple and accessible way to protect the heart. A small daily dose, commonly called baby aspirin, was believed to help prevent heart attacks and strokes by reducing the tendency of blood to clot. And in certain specific circumstances, that is still true. For individuals who have already experienced a heart attack or a stroke, or who have clearly identified high-risk conditions, aspirin can still play a meaningful protective role. But here is where the picture has changed. More recent research has demonstrated that for many adults over 60 who have not previously had a cardiovascular event, taking aspirin routinely may not deliver the protective benefit that was once assumed, and in some cases it may actually work against them. Now let us understand the mechanism. Aspirin functions by reducing the ability of platelets to bind together. This helps prevent clots from forming within arteries. But clotting is not something that is purely harmful. It is also one of the body's essential defense systems. It is how the body stops bleeding when blood vessels are damaged. After 60, blood vessels become more delicate, the lining of the digestive tract becomes more susceptible to irritation, and the balance between clotting and bleeding grows far more fragile. So when aspirin reduces clotting ability within this context, it can raise the risk of internal bleeding, particularly in the digestive tract or the brain. Now you might wonder how exactly that ties back to stroke or heart risk, and this is where the nuance becomes essential. There are two primary types of stroke, one triggered by a clot that obstructs blood flow, and another caused by bleeding inside the brain. Aspirin can lower the likelihood of clot-related strokes, but it can raise the risk of bleeding-related strokes. And after 60, particularly in the absence of a documented cardiovascular history, that balance can shift for certain individuals, where the risk of bleeding begins to outweigh the protective value. And this is exactly what more current clinical guidelines have started to acknowledge and reflect. Now here is what makes this even more relevant. Many people began taking aspirin years ago based on older guidance and simply never stopped. No update, no reassessment, because it had become a comfortable and familiar habit. But medicine continues to evolve, and what was once considered standard practice does not always remain the best path forward. This is not a statement against aspirin. It is a reminder that it is specific. It must be aligned with the right situation, the right risk profile, the right individual. And this is where knowing your own context becomes absolutely essential, because taking aspirin as a precaution without understanding whether it genuinely benefits you can introduce risk without delivering real protection. Now here is the shift that matters most. Throughout this video, we have examined 5 medications, each working through a different mechanism, each affecting the body in its own distinct way. But they all share one common thread. Their risk increases when they are continued the same way, even as the body is no longer the same. And this is where control shifts back to you, because the most important move is not eliminating everything. It is identifying what deserves to be re-examined. So here are a few concrete steps that genuinely make a difference. First, review your medications with intention, not only when something feels wrong. Proactively reach out to your doctor or pharmacist and ask whether you still need this at the same dosage, whether your risk profile has shifted, and whether there is a more appropriate option for where you are now. Second, pay close attention to combinations. Many of the risks we explored today do not come from a single medication, but from the way multiple substances interact. Even medications bought without a prescription, even occasional use, it all adds up. Third, stay attuned to quiet signals, not dramatic events, but small, consistent changes. Increased fatigue, shortness of breath, unusual dizziness, shifts in your blood pressure readings. These are often early indicators that something needs to be looked at. And finally, recognize that your body is not static. What was effective a decade ago may not be ideal today, and that is not a failure of any kind. It is simply how the body continues to evolve. Now, what we have walked through today gives you a solid foundation for where the risks can originate, but the most meaningful part is still what you do with it, because understanding the issue is only one side of the equation. What truly matters is how you apply that understanding moving forward, and how you use it to protect your health in a way that is practical, grounded, and suited to how your body actually functions today. If there is one core message to carry away from all of this, it is this. The real risk is not the medication on its own. It is continuing to use it in the same way while your body is no longer the same. Because after 60, your body is not simply an older version of what it was before. It functions differently. It metabolizes substances differently. It responds to stress differently. And above all, it tolerates imbalance far less easily. That means even small mismatches, small excess amounts, small interaction effects can have a much larger impact than they once would have. And this is the pattern many people unknowingly fall into. They continue what has always worked. They trust what has always been prescribed. They follow the same routine day after day, year after year, without realizing that the underlying conditions have changed. And this is not about having done something wrong. It is about something that was never clearly explained. Because in medicine, there is a principle that rarely gets enough attention. Not everything needs to be added. Sometimes things need to be adjusted, reduced, or reconsidered. And that process is just as important and valid as starting any treatment in the first place. Now here is where this becomes genuinely empowering rather than cause for worry. Because once you truly internalize this principle, you begin to see your health through a different lens. You stop viewing medications as fixed and unchanging solutions, and you begin seeing them as instruments, tools that need to be used at the right time, in the right amount, for the right stage of life. And when that alignment is correct, they can be incredibly effective. But when that alignment drifts even slightly, that is where risk quietly begins to accumulate. Now think back across the 5 medications we examined. Pain relievers like NSAIDs, valuable for controlling inflammation, but capable of elevating blood pressure and causing fluid retention when used over the long term. Acid-suppressing drugs like proton pump inhibitors, useful for protecting the stomach lining, but capable of disrupting nutrient absorption and affecting vascular function over time. Benzodiazepines, settling the nervous system, but potentially reducing movement, altering sleep-related breathing and affecting circulation. Decongestants, clearing nasal congestion, but tightening blood vessels and increasing the load on the cardiovascular system. And aspirin, offering protection against clot formation in the right scenario, but raising bleeding risk when used without a clear and current indication. Each one has a purpose, each one has genuine value, but each one also has a threshold, a point where the balance can tip, and that point is not fixed. It shifts with age, it shifts with changes inside your body, it shifts alongside other medications, with lifestyle choices, with underlying health conditions. And that is why awareness is the most powerful thing you have, because awareness leads to better questions, and better questions lead to smarter decisions. Now here is something simple but remarkably effective. At your next appointment with your doctor, Rather than only bringing up new symptoms or asking about new prescriptions, bring this question. Is everything I am currently taking still the right fit for me at this point in my life? That single question reframes the entire conversation. It moves the focus away from adding and toward evaluating, away from reacting and toward optimizing. And very often it opens the door to adjustments that reduce risk without removing support that is still necessary. Because once again, the objective is not to eliminate everything. It is to make sure that everything you are taking is genuinely still working in your favor. Now, there is one more important thing to mention. Your body sends signals. They are not always loud, but they are consistent. And developing the habit of noticing them can matter enormously. A gradual increase in fatigue, a sense that your energy depletes faster than it used to, lightheadedness when you stand up, shortness of breath during activities that previously felt easy, shifts in the quality of your sleep. These are not always alarming, but they are meaningful. They are frequently the early signs that something within the system deserves attention. And when you combine that kind of awareness with consistent review, you develop a level of understanding and control that most people never reach. Now, here is where it all comes together. The difference between responding to a heart attack or stroke and preventing one often comes down to small adjustments made early. Not one major change, not one dramatic intervention, but a series of small, well-informed decisions that keep your system in balance over time. And this is where you hold more influence than you may currently believe, because while you cannot control every risk factor in your life, you absolutely do have control over awareness. You have control over asking the right questions, and you have control over making sure your current habits still match your current body. That is what truly makes the difference. Not anxiety, not avoidance, but alignment. Now, if this gave you useful clarity or shifted the way you are looking at your daily routine, consider staying connected to this channel, because this is exactly what we are here for. Not quick fixes, not sensationalism, but clear, practical understanding of how the body truly works and what genuinely makes a difference over time. And if someone you know is managing daily medications, particularly after the age of 60, sharing this with them could be one of the most valuable things you do, because sometimes the most meaningful shifts in health begin with a simple realization that what was working before may deserve a second look. And once that realization takes hold, you begin making decisions from a completely different place.